The Palliative Performance Scale, PPSv2. What is the Palliative Performance Scale, PPSv2? The Palliative Performance Scale, PPSv2, is a clinical assessment tool used to measure the functional performance of patients receiving palliative care. It's designed to help healthcare providers track disease progression and estimate prognosis, particularly in end-of-life care settings. How it works. The PPSv2 uses a scale from 0% to 100% in 10% increments, where 100% equals fully ambulatory and healthy. 0% equals death. 5 key dimensions assessed. 1. Ambulation, ability to walk and move around. 2. Activity and evidence of disease, work capacity and disease symptoms. 3. Self-care, ability to perform daily tasks independently. 4. Intake, oral food and fluid consumption. 5. Conscious level, alertness and awareness. Ambulation, the items, mainly sit, lie, mainly in bed, and totally bed-bound, are clearly similar. The subtle differences are related to items in the self-care column. For example, totally bed-bound at PPS 30% is due to either profound weakness or paralysis such that the patient not only can't get out of bed but is also unable to do any self-care. The difference between sit, lie, and bed is proportionate to the amount of time the patient is able to sit up versus need to lie down. Reduced ambulation is located at the PPS 70% and PPS 60% level. By using the adjacent column, the reduction of ambulation is tied to inability to carry out their normal job, work occupation or some hobbies or housework activities. The person is still able to walk and transfer on their own but at PPS 60% needs occasional assistance. Activity and extent of disease. Some significant and extensive disease refer to physical and investigative evidence which shows degrees of progression. For example, in breast cancer, a local recurrence would imply some disease. 1 or 2 metastasis in the lung or bone would imply significant disease, whereas multiple metastasis in lung, bone, liver, brain, hypercalcemia or other major complications would be extensive disease. The extent may also refer to progression of disease despite active treatments. Using PPS in AIDS, some may mean the shift from HIV to AIDS. Significant implies progression in physical decline, new or difficult symptoms and laboratory findings with low counts. Extensive refers to 1 or more serious complications with or without continuation of active antiretrovirals, antibiotics, etc. Self-care, occasional assistance, means that most of the time patients are able to transfer out of bed, walk, wash, toilet and eat by their own means, but that on occasion, perhaps once daily or a few times weekly, they require minor assistance. Considerable assistance means that regularly every day the patient needs help, usually by one person, to do some of the activities noted above. For example, the person needs help to get to the bathroom but is then able to brush his or her teeth or wash at least hands and face. Food will often need to be cut into edible sizes but the patient is then able to eat of his or her own accord. Mainly assistance is a further extension of considerable. Using the above example, the patient now needs help getting up but also needs assistance washing his face and shaving, but can usually eat with minimal or no help. This may fluctuate according to fatigue during the day. Total care means that the patient is completely unable to eat without help, toilet or do any self-care. Depending on the clinical situation, the patient may or may not be able to chew and swallow food once prepared and fed to him or her. Intake. Changes in intake are quite obvious with normal intake, referring to the person's usual eating habits while healthy. Reduced means any reduction from that and is highly variable according to the unique individual circumstances. Minimal refers to very small amounts, usually pureed or liquid, which are well below nutritional sustenance. Clinical applications. Tracking functional decline over time in terminal illness. Helping with care planning and resource allocation. Facilitating communication among healthcare teams. Assisting with prognostic discussions with families. Determining eligibility for certain palliative or hospice services.